Welcome back. A multidisciplinary team made up of 70 healthcare professionals from the United States were in Jiwa community to provide free healthcare covering surgeries, obstetrics and pediatrics, among others. Well, this week on FCT in Focus, we'll take a look at Jiwa, a suburb in the Abuja Metropolitan Council. Take a listen.
This is Jiwa, an hour drive from the Abuja city center. The community is plagued by poor sanitary conditions, with blocked drainages and lack of basic amenities. These are the realities the residents have had to live with for years.
All these local midwifery, these people, they are charging their prices are too exorbitant. When somebody just put to bed, they collect 15, 16, 20.
No water, no NEPA, no health facilities. When you fall sick, you have to find a medical facility somewhere else. Either you go to Guarimpa or like Use or any other place. You felt you can be taken care of, right?
Jiwa is just one of many suburbs in the FCT, with similar stories of almost non-existent healthcare services, and the poor sanitary conditions are making the situation worse. However, things might be looking up for the residents of Jiwa, as Nigerian medical personnel who are practicing in the Americas are here to flag off a medical outreach for the residents of the community, and it's free of charge. A development which the Emir says is a blessing to the town.
The medical outreach in Jiwa is a very, very, very great and excellent achievement. Our community who have been sick have been looking the way to treat themselves. Otherwise, they cannot. Today, the medical teams are here. Neurologists are there, pharmacists are there, cardiologists are there, and so on. We are a rich man that has money, go outside and look for them. Look at a common man has captured them in the kingdom. It's an achievement. So we thank the group for their support.
From the United States and...
Speaking at the event, the leader of the team of medical professionals and president of the Association of Nigerian Physicians in America gives us an idea of the scope of the medical services to be provided and why they have embarked on this mission.
The United States and some of our expatriates that we invited to come with us, together with nurses and pharmacists, the National Association of Pharmacists and Pharmaceutical Scientists. We all are here together to provide collaborative medical care. The way we will do it in America, any part of the world, and so we value the country. We want to make sure that the healthcare is up to par, and we want to be part of the people providing that healthcare. This program is being run in 3 different centers, one Jiwa, the other one Tungu Kwanso, and the other one in Kubwa Hospital, where we will perform all our surgical cases. We intend to see at least 300 to 400 cases per location each time, with the surgical cases anywhere from 20 to who knows what we do. Last year we were able to do 80 cases in 5 days. This year we intend to do maybe 120, 150 cases of surgical cases in 5 to 6 days. We intend to take care of up to 3,000 people or more. We have to see what happens. Every year we go to a different state. So this year is in Jiwa. Last year we were in Anambra State. The year before we were in Lagos State. Next year we will be somewhere, you can be sure. And we have partners working with us. One of the most consistent partners that we've always worked with, you wouldn't believe it, are young people like all of you.
Very excited.
The Minister of Health is also grateful for the outreach. He calls for more partnership from other healthcare providers and urges citizens to take advantage of the treatments.
This is the outcome of a well-planned strategy to network with our people in the diaspora so that they can give back to the community. And we are quite happy that the turnout is huge, very impressive, and I think our people will be the beneficiary. Well, essentially we are limiting it to this area, but people can come from anywhere. So anyone in Nigeria can come here. The treatment is free, it will include surgery, and there are no limits. So whatever it is, we'll do a checkup and treat you free.
About 70% of Nigeria's health budget is spent in urban areas, where about 50% of the population reside. And this poses a burden on healthcare delivery in rural areas like Jiwa. The nation's capital also struggles with the problem of a central sewage system, which many suburbs have no access to. The Global Burden of Disease study states that 5 million deaths in 2016 were as a result of poor quality health care, and migration of medical personnel from Nigeria is still high. Initiatives such as this one from this multidisciplinary team of healthcare professionals is a big help. However, infrastructural gaps must be filled to see any real progress in healthcare delivery in Nigeria.